Sometimes I like to joke about it and I like to take things just generally lighthearted, but yeah, I do have a significant and serious soft spot when it comes to mental health issues. Yes, I think that some of the stuff is overblown, but there are legitimate concerns that are out there, and while I normally like to stay on the side of, men's mental health issues and how chances are if you're feeling depressed or something like that, it's, just a deficiency in something that you're doing, just holding men accountable gives them purpose, and therefore they're just going to get foisted onto something else. But when it comes to the female side of things, I do have sympathy for it, okay? Guess what? I have a mother. It's not something that I normally talk about or anything like that, but I have a sister as well, and, aunts and cousins, and my grandmother has since passed, and the other one I haven't seen since I was 16, so I have healthy relationships with the fair few women that are out there. So I do see their struggle. I do recognize it. I just think sometimes it's a bit overblown. So I got two articles that are right here, and I don't want to, downplay any thoughts of this stuff, but the way that it's reported compared to the way that you have to dig deep when it comes to males issues, society doesn't give a single shit about men's mental health problems, and you know what? That's fine. Use that as motivation in and of itself, because the world doesn't care if you succeed or not, because, well, you're kind of not the consumer base. It's overwhelmingly women, so they need to try to keep them as healthy, happy, and, to be completely honest, medicated as possible, because Peak, who's also putting out these studies as well, while I understand that there are unique problems faced by men and women separately, I think some of the general advice does remain salient for both parties involved. Trying to find solution at the bottom of a pill bottle isn't really going to help you. You're depressed. Or I'm sorry, you're not going to the gym because you feel depressed. No. You feel depressed because you're not going to the gym. Something else that's often self-reported is women's, dissatisfaction with their looks, or they just feel like they're being objectified, or they're just not living up to conventional beauty standards, or all that stuff. No, the average United States woman, 5'3" to 5'5", weighing 170 pounds, you are clinically obese if that's what you are. Your BMI, Lord, it's what, in the 30s? It's in the touching 40s? I haven't run the numbers or anything like that, but it is a beach ball person. It's not walking anywhere. It's not running anywhere. It is rolling wherever it needs to go to consume more empty calories that are marketed towards women, because, yes, they are 60% of the consumer base, hold 80% of consumer debt. They just tell you that you need to buy because, oh, look at all of these happy people in our commercials. It's poison. Mass media, social media, big tech is poisoning the mind of women, and that's what's making them think these nefarious thoughts. Nearly 1 in 3 high school girls have seriously considered ending it all. I'll say that. Nearly 1 in 3 high school students, female high school students considered, taking matters into their own hands in 2021, according to the latest survey data from the U.S. CDC. Almost all indicators of poor mental health, which include unhealthy thinking patterns, like, am I ever going to be able to go back to school and rub shoulders with my classmates, or are these lockdowns just going to go on forever? And self-harm thoughts worsened significantly by 2011 to 2021. Does that also coincide with the amount of SSRIs that are pushed on kids? How many happy pills that are shoved down these kids' throats? How many times that they're told to question their gender? Oh, you're going through this very troubling time right now. High school girls in the United States, right? Okay, so you guys start grade 9. Up here in Canada, it's 7, 8, and 9 is middle school, and then 10, 11, 12 is your high school. So how old are you in 9th grade? So 15? Yeah, so girls have already gone through puberty for the most part, so now they're just trying to reconcile all of those changes afterwards, getting all that additional attention as well, or too much or too little, not really knowing how to maneuver in those situations. Meanwhile, the guys are also going through their troubles as well, so everybody's just trying to figure out what the hell is actually going on after all of these biological changes happen. And it's wild. This was the Fresh and Fit podcast with Coach Red Pill, Gonzalo Lira. Really great episode. 4.5 hours long. I would highly recommend it. I've listened to it a couple of times. But they were talking about how the public school system and society in general is just preying on young women, especially going through the time of significant change where everything starts popping, things start changing. For most guys, they can just benefit from some of those quick changes, like you're just, a 1.5 feet taller over the course of a summer, as opposed to women. They go through significant biological changes. They have no idea what the hell is actually going on. There's like anatomy that wasn't there yesterday and things that are happening down below that have never happened before in your life, and you think that, oh my god, normally when I see that I think I'm dying. Like, it's an incredibly confusing and manipulative time from the right people who think that, oh no, you're just having a tough time going through this point in time. No, don't worry. That's just your body telling you that you're actually a boy, because that's what public school systems have been pushing for about a decade at this point. This isn't something new. This is just something new to people who had the opportunity to peer over their kid's shoulder while they were stuck at home, just piecing out from a virus that, well, didn't really pose them much threat to begin with. But the CDC doesn't want to tell you that. It's just, oh yeah, kids are sad and we should do something about that. It's just try to foist it on boys in some form or fashion, right? But okay, according to the CDC's biennial Youth Risk Behavior Survey Data Summary and Trends Report, which based on a 90-question survey completed by over 17,000 high school students from 152 schools across the country, a pretty decent sample size. Overall, 29% of respondents said that they experienced poor mental health in the past year. Or the past month, while 42% that they felt so sad or hopeless almost every day for at least 2 weeks in a row, to the point that they stopped doing their normal activities. Girls, 57%, were found to be more likely than boys, 29%. Yo, that is significantly different. To experience persistent feelings of sadness or hopelessness. By comparison, just 36% of girls and 21% of boys in 2021 reported feelings of persistent sadness or hopelessness. Very, very interesting. As the world, as society becomes far more gynocentric, who's reporting lower levels of satisfaction? Women. But are they acting on it? Because we know the studies as well. It's 3 out of 4 suicide victims are men. So, according to the report, 22% of respondents seriously considered it. Percentage of girls ending lives increased from 19%, so up 3%. Okay. For boys, unchanged, 13 and 14 in 2021, so it's about the same. Young people are experiencing a level of distress that calls on us to act with urgency and compassion, said CDC Division of Adolescence and School Health Director Kathleen Ethier. Of course, right. And what's your solution? More pills, right? That'll definitely help. With the right programs and services in place, schools have a unique ability to help our youth flourish. I wouldn't trust the school to teach the correct way to do math. I've seen those slides of Common Core that are out there, let alone mental health problems. That relies heavily on a good, strong familial unit, which you are probably also teaching isn't the best thing for ya. When it comes to bullying and violence, the report showed that teenage girls experience worse outcomes compared to boys. Yeah, because here's another unflattering truth. Men need trauma in order to flourish and become men. Nobody who's ever got it out the mud did it easily and ended up going on to a successful life from the standpoint of a man. But as for women, trauma builds men, trauma ruins women. That's just the reality of life. Take a look at my previous example of puberty and going through all that stuff. Women reporting higher levels, even if you want to take this out of the context of the high school, but just putting it into your modern dating scene, your 18 to 30-year-old single women, woo, your party years, right? Your whole phase. The more sexual partners, the lower levels of satisfaction. The older a woman gets, the longer she stays single, the lower level of happiness. Also coinciding with the prescription of SSRIs and antidepressants as well. So yeah, it's no surprise that boys fare a little bit better if they engage in physical violence, or they have it inflicted on them, especially if they're in certain high schools and certain inner cities, compared to their male peers. Females respondent reported higher rates of not going to school because of safety concerns. Being electronically bullied, that's not a thing, you can turn it off. Being bullied at school or being forced to, what? Okay, almost 20% of girls reported experiencing SA. Great, wonderful, fantastic. And it kind of curtails into this article, which I thought we'd have a much easier handoff, but I guess not, man. Teenage girls are being forced to have sex at the highest levels we've ever seen. Like, they're getting pinned down, or it's like, well, I felt like, interesting. So we got to get delicate here. So yeah, the questionnaire was completed by students in 2021. Results revealed that a disturbing 14% of high school students said that they had been forced without giving consent. Interesting. Compared to 12% in 2021. New figure represents 1 in 17 girls. Oh, is that going to be the new stat that runs around? Kind of like how college campuses, 1 in 4 girls. Like, just what's your definition? What are the terms on the checklist? Oh yeah, the way that Ether is trying to frame that. If you think about it, it's 1 in 7 girls. At least 1 or more has possibly been, and that's the highest level that we've ever seen. Really are alarmed. She told the Washington Post. That's why I'm thinking that those responses might not be asking the right questions. I'm just wondering. In the same time frame, male students said that they've only been forced to have sex remain the same at 4%. Yeah, we don't care about those 4% though. 12% of girls who didn't have consent. Now that's a problem. Meanwhile, who cares what the alphabet kids? Okay. They're already confused enough about everything. So, just trying to foist on more government interference is really going to help them out. It's done them wonders so far. Nothing against the kids. It's just these nefarious, these predatory groups that are over top of this stuff, trying to push their just failed ideologies even harder. So sexual contacts. Opposite sex only. Okay, any same sex. Oh, so this is kind of like highly skewed a bit. So female 14%. Just the breakdown demographics. So mostly just the rainbow community, really, or anybody who identifies on that spectrum. They're kind of overrepresented by this. That's very interesting. During the pandemic lockdown, domestic violence cases increased, and it's likely that sexual abuses did as well. March 2020, for the first time ever, minors were half of the people calling to the that's very tragic. Calling into the National Sexual Assault Hotline for help, according to RAIN. Okay. The survey showed that supposed to be that nearly all indicators of poor mental health among high schoolers, including self-deletion thoughts and behaviors, have increased in the last decade. Yeah, of course, we aren't going to go ahead and address the elephant in the room of pushing a certain agenda. Lord have mercy, why would we want to talk about that? More than 140,000 children in the United States lost a primary or secondary caregiver, with youth of color disproportionately impacted. Yeah, of course. So it's not enough that women are going through some tough stuff. You also got to, break that down a little bit. Oh, sorry, girls, we know that it's a problem, but Jessica, your problems aren't quite as bad as LaQuisha's. So we just need to go over there and deal with her and Sandra Littlefeather. We just need to go ahead and deal with them. We are caring for young people with soaring rates of depression, anxiety, trauma, loneliness, and suicidality that will have lasting impacts on them, their families, and their communities. You don't ever look at solutions. You just continue to push these little bandages in the form of nice little pills. It would definitely help kids' mental health? Getting them out of public schools. Keeping the family unit together. Stop lying to girls. Stop lying to boys. Stop lying to everybody with your failed ideologies. All of your indoctrination. But because you aren't going to do that, just remove yourself. Remove your kid from that situation before the worst of the worst ends up happening. Kids, man, they're super vulnerable, and you know exactly who's coming to prey on them. You know exactly who's causing most of this sadness, and armed with that knowledge, it's ultimately your choice at the end of the day. So, with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.